Tinnitus is a common complaint that we get in the clinic and impacts about 10 to 15% of the general population. Tinnitus is a ringing, buzzing, or hissing sound that occurs in one ear, both ears, or can be perceived as being in the middle of our head. And tinnitus is the perception of sound without there actually being a physical sound source present. Tinnitus can be classified as subjective, which is only heard by the individual and is the most common type of tinnitus. And there's the less common type of tinnitus known as objective tinnitus, and this is heard by the individual as well as others around them. Tinnitus generally affects about 10 to 15% of the population and is classified as bothersome if it impacts one or more aspects of quality of life or activities of daily living. Tinnitus is considered to be permanent if it's been there for a duration of 6 months or longer and is heard for at least 5 minutes per day. There is a lot of misinformation surrounding tinnitus. And unfortunately, a lot of patients are told that they just have to live with it. However, that's not the case. There's a lot of really successful tinnitus management techniques available to help reduce your overall perception of tinnitus. I think a comprehensive hearing assessment is the first step in completing tinnitus management. This will provide valuable information related to your hearing and your tinnitus that will help guide our clinical decision making to ensure that every patient is receiving the best individualized treatment. Within a comprehensive hearing assessment, I've divided it into 3 categories. The first is case history. I think a thorough case history is going to provide a lot of valuable information related to your hearing, your past medical history, as well as your tinnitus. It can provide us information related to the onset of your tinnitus, any bothersome situations or disruptions as a result of your tinnitus, any management techniques that you've tried in the past, and anything or symptoms that worsen or improve your tinnitus. The next step is the hearing assessment. And this is really helpful because it will provide a baseline of your hearing that we can compare to in the future. But it'll also help us evaluate if your hearing is normal or if there's some degree of hearing loss present. The implementation of management techniques like sound therapy will help us guide our decisions for candidacy for other methods as well. The last aspect is self-assessment measures or questionnaires, but also help better understand the disruptions to an individual as a result of tinnitus. And these are really helpful because they can be completed pre and post treatment. And this will really help us to evaluate, but identify how much progress a patient has made. One of the management techniques I also like to discuss when talking about tinnitus with the patient are lifestyle considerations or modifiable factors. The first thing I always discuss is physical exercise. Physical exercise is great for our overall well-being, but can also help with our perception of tinnitus. Another factor to consider is proper sleep hygiene, so ensuring that we're getting enough proper rest. Now, for individuals who experience disruptions in sleep because of their tinnitus, techniques that we discussed in earlier videos can help with our perception of our tinnitus either while we're trying to fall asleep or stay asleep. It's also important to really address stress management. For a lot of patients, stress can be a factor that worsens their tinnitus. And so using stress management techniques like mindfulness, relaxation, visual imagery, meditation can all be helpful to reduce our stress and ultimately reduce our perception of tinnitus. Another factor that I like to consider, and is very simple, is just maintaining a positive outlook. It can be very easy to take the negative aspects of tinnitus and kind of spread that across what we do day to day. And then lastly, I think it's really important to continue participating in activities you find enjoyable.